I'm Larry Dossey, and my profession has been that of an internal medicine physician. I practiced medicine in Dallas for about 25 years, and before that served as a battalion surgeon in Vietnam. And for the last 10 or 15 years, my preoccupation has been with looking at the role of spirituality in healthcare and the role of prayer, particularly in health outcomes. I have a special interest in this because I was so shocked when I first came across this data, because I was trained to believe as a physician that spirituality simply did not matter where health and illness were concerned. My position on this has changed 180 degrees. I personally think now, after looking at this information for over 2 decades, that this is one of the best kept secrets in modern medicine. Interestingly, my own profession, which has resisted this tremendously, is coming around to another point of view. Nearly all of the medical schools in the country now feature courses looking at the role of spirituality in healthcare, which is just a tremendous turnaround from the situation even a decade ago. So I think we can say that spirituality truly is returning to medicine. And for my own part, I'd say it's about time. I was astonished during my first year of medical practice to come across a patient who had terminal lung cancer. And there was no treatment at that time for this man. And all he wanted was to go home and be allowed to die in the privacy of his own family. The only treatment he had in this big academic teaching hospital was that the congregation from his church came to be with him during all visiting hours, and they prayed like crazy for him. I couldn't even get to the bedside because of these people to do even basic medical care. I consider this a frivolous treatment. He wanted to go home to die, so I discharged him. I forgot about him, and I was certain that he would be dead within a week or so. I was shocked a year later when he showed up back at the hospital with a case of the flu. So I went down to the radiology department and looked at his current chest x-ray, which was normal. I compared it to the previous one, which showed this horrific lung cancer, which involved both lungs. And the only therapy which he said that he had was prayer from the congregation. I was disturbed by this and sought out some of my old professors to ask them their opinion about this. One of them said something very helpful. He said, "Well, Larry, we see this." That was extremely helpful. And I sought out another professor, and he said, "Well, you see enough cases of lung cancer, and this is just one of those things we see as the natural course of the disease." This showed me how we really will go to any lengths to ignore and dismiss spiritually related therapeutic remissions, so-called spontaneous remissions, when they occur in the context of prayer, devotion, and so on. I thought about that case for many years. And then in 1988, when I came across the first so-called double-blind, randomized, controlled study in prayer, I thought about that case, which I'd seen 10 years prior. And so this kindled a resurgence of interest on my part about whether or not spiritual interventions really could do something in the course of illness.